Today, my name is Anthony Tanyo, and today I'll be presenting my systematic review titled School-Based Physical Activity Interventions for Youth with Disabilities. This review examines how different types of school-based exercise programs influence physical fitness, cardiometabolic health in children and adolescents with disabilities. Why this matters? This topic matters because youth with disabilities consistently show lower physical activity levels compared to their typically developing peers. Research also shows they experience higher cardiometabolic risk, including elevated blood pressure, cholesterol, and obesity rates. Schools are one of the most accessible and equitable environments for delivering structured physical activity. For many students with disabilities, PE may be their only opportunity for consistent movement. So, understanding what works and what doesn't can improve their health, participation, and inclusion. In this slide, we look at breaking down the guiding question. We look at the population. This refers to the specific group of patients or population you're interested in studying. In this case, children and adolescents with disabilities. Now we're looking at the intervention. This is the treatment or action you're considering. In this review, it will be school-based physical activity programs such as aerobic exercise, resistance training, high-intensity interval training, sports games, and rhythmic movement. Comparison. This is the component involving comparing the intervention to another treatment or control group. It helps to determine the effectiveness of the intervention. The comparison here is no intervention at all or usual school activities. Outcomes. This refers to the results you want to measure or achieve from the intervention. It could include improvements in health, quality of life, or other measurable effects. This review is looking at improvement of health-related physical fitness, skill-related physical fitness, and cardiometabolic health. So, our guiding question was, in children and adolescents with disabilities, do school-based physical activity interventions improve physical fitness and cardiometabolic health compared to no intervention? What methods were used? To answer this question, preferred reporting items for systematic reviews and meta-analysis guidelines were used, and three major databases were searched: Web of Science, Scopus, and PubMed. The search identified 474 studies. After removing duplicates and screening titles and abstracts, 18 studies met all inclusion criteria. Participants ranged from 7 to 17 years old, and disability types included intellectual disabilities, autism, Down syndrome, cerebral palsy, physical disabilities, ADHD, and mixed developmental disabilities. This gave a diverse sample to evaluate the effectiveness of school-based exercise across disability categories. The interventions varied widely, but most fell into a few major categories: aerobic exercise, resistance training, combined aerobic and resistance training, high intensity interval training, sports games, rhythmic gymnastics, and Tai Chi. Combining training and aerobic exercises were the most common, but the diversity of interventions allowed me to see which approaches consistently produce benefits. Over the next three slides, we're going to take a look at some of the outcomes. Across the 18 studies, the strongest and most consistent improvements were in health-related physical fitness. Cardiorespiratory fitness improved in 12 out of 14 studies that measured it. Muscular fitness, including strength and endurance, also improved in most studies, regardless of disability type. And flexibility increased in 3 out of 5 studies. These results show that even relatively short school-based programs can meaningfully improve foundational fitness components. The review also found strong improvements in skill-related physical fitness, which is especially important for students with disabilities who often experience motor delays. Across studies, I found better balance, better coordination, increased power, and improved agility. These improvements matter because they directly support participation, confidence, and independence in PE and in daily life. Cardiometabolic outcomes were much more mixed. Some studies showed reductions in body weight, BMI, waist circumference, or body fat percentage, but many showed no significant change. Similarly, markers like blood pressure, glucose, and cholesterol rarely improved. This suggests that school-based PE alone may not be enough to change cardiometabolic health, especially without longer duration, higher intensity, or complementary nutrition interventions. One of the most encouraging findings was that these programs were safe and well tolerated. 7 out of 8 studies that reported safety found no adverse events. Adherence averaged around 92%. This means that students with disabilities not only participated, but they enjoyed and stuck with these programs. This is important for teachers and administrators who may worry about safety or engagement. These findings have several practical implications for teachers. First, school-based programs are safe and effective for students with disabilities. Second, even short, structured sessions 2 times per week can improve fitness. Third, high-intensity interval training and games-based activities work particularly well because of requirement of minimal equipment. Fourth, because cardiometabolic changes are limited, teachers should focus on fitness, skill development, and participation while monitoring long-term health in collaboration with school nurses or wellness staff. Finally, this evidence supports Guam's ongoing efforts to build inclusive, disability-aware PE programs that emphasize fairness, access, and belonging. There were several limitations. First, the review did not include a meta-analysis, so I couldn't calculate pooled effect sizes. Second, many studies had small sample sizes, which limits generalizability. Third, interventions were heterogeneous, different durations, intensities, and activities, making direct comparisons difficult. Despite these limitations, the consistency of these findings across diverse studies strengthens the overall conclusions. Over the next 2 slides, I'll be highlighting the most actionable takeaways from this systematic review, things that PE teachers can use immediately in their classes. First, the evidence is very clear. School-based PE is a powerful intervention for students with disabilities. Across almost all 18 studies, both health-related and skill-related fitness improved. That includes cardiorespiratory fitness, muscular strength, flexibility, and also agility, balance, coordination, and power. The key point here is that we don't need clinical or specialized environments. Regular PE classes can produce meaningful physical gains. Second, the most effective intervention type was combined aerobic and resistance training. A simple structure like 10 to 15 minutes of aerobic activity, followed by 10 to 15 minutes of resistance work, and a short cool down aligns with what the research shows works best. Third, adapted high-intensity interval training is both safe and effective. Short bursts of movement with longer rest periods work especially well for students with attention challenges or low motivation. Importantly, the studies reported no adverse events with high-intensity interval training. And finally, even low frequency, just 2 sessions per week, was enough to produce improvements. That's encouraging for schools like ours in Guam, where PE schedules can be tight. The takeaway is that consistency matters more than volume. On this slide, I'm focusing on broader implications for schools and inclusive practice. First, cardiometabolic outcomes like BMI, cholesterol, and blood pressure showed mixed or minimal changes. This tells us that PE alone may not shift these markers, so we need to set realistic expectations with families and administrators and collaborate with wellness or nutrition programs when cardiometabolic changes are a goal. Next, the programs in the review were very safe and had high adherence, around 92%. Students with disabilities not only participated but enjoyed the activities. This is strong evidence that we can use to advocate for more PE time or adapted equipment. The review also reinforces the importance of targeting motor skill deficits. Many students with disabilities have lower skill-related physical fitness, so integrating stations for balance, agility, coordination, and power is essential. Another key point is that inclusive, engaging activities like games, dance, rhythmic movements, and circuits were consistently effective. These are easy to modify and can be culturally relevant, which is especially important in the areas that we live in. Incorporating tomorrow dance or local games can make PE more meaningful and inclusive. Finally, PE plays a major role in helping students meet activity recommendations. Short, structured bouts of movement and active transitions can help students accumulate more moderate to vigorous activity throughout the day. Overall, this evidence supports advocating for more resources, more training, and more inclusive PE programming across our schools. Here you'll find the APA citation for the study. And last but not least, we go to our conclusion here. Um, this is a sunset picture from another beach side area here on Guam. Uh, this silhouette here is a large thing at the governor's complex called the Latte of Freedom. So it's actually something you can go and visit, and this is on the west side of Guam. We're just right off the capital. Um, so yeah, I hope you enjoy this one. And so with my conclusion, school-based physical activity interventions are a powerful tool for improving both health-related and skill-related physical fitness in children and adolescents with disabilities. Cardiometabolic outcomes remain unclear and likely require longer or more intensive interventions. But overall, the evidence strongly supports using PE as a primary avenue for promoting health, inclusion, and physical literacy among students with disabilities. Thank you for listening. Have a great day.